morning and welcome back to School Comments. It is August 22nd, 2022, and I am happy to have Dr. Bray here with me to let us know how we are doing with COVID numbers on this first day of school. Dr. Bray?
Good morning, Dani. Good news, COVID conditions are improving. The CDC just moved Dallas County, this was on Friday, out of its high-risk category for high risk of transmission. This is the category by which the CDC suggests everybody wear masks indoors. Our levels have greatly improved. As you can see from the dashboard, our new cases in the last 7 days are down 16%, almost 20%. From where we were a week ago. Our active cases are down. This continues a trend that we have been seeing. Let me pull that trend line up because there's a few interesting things to talk about in here. So let's go to the trend tool. So what you're looking at on the top left is active cases, number of active cases that we've seen since the beginning of the pandemic. Our first data point is January 22nd of 2020. This was about 2 months before any cases showed up. These first 3 waves are actually, we don't really see, you could almost see a bump there. That's that first wave of original COVID. That's the second wave. That's the third wave that peaked in January of 2021. And then we start to see Delta. We see the incredibly contagious Omicron, and now we're seeing BA.5, and you can see we're coming back down on BA.5. This is a trend that we're seeing statewide, and we're seeing county by county as well. These numbers are continuing to go down. There's some thought that that the way that the waves are behaving with BA.5 is probably what things are going to look like going forward. Remember, the biggest impact is that orange line is likely higher, but with at-home testing, so many people are able to test themselves at home. That data does not go into our healthcare data system. For the most part, at-home data is not included because it's not reported to a healthcare provider. Many of these folks stay home, they avoid spreading the disease, and they continue to mend. So if we can keep that behavior up, if we can stay home when we're sick, and for all you comments returning to class, reach out to your professors. As a professor myself, I can tell you I would much rather you stay at home than feel like you need to be a trooper and come in and get other people sick. If you are sensitive to the virus, if you're taking care of people with sensitivities at home, make sure you wear a mask. That's one of the biggest protective factors that's out there. All right, so we can continue this fight. Things are moving in the right direction, but the virus is always evolving, and so we will likely see another wave sometime in the future, more contagious, less deadly.
Thank you so much, Dr. Bray. We will see you next week.
Thanks, Dani.